Hi, so we are in the third quarter of 2025, and there is a lot of talk about health and making America healthy again. And without getting political, I think we all could agree on a systemic public health, which is millions of people, that we always could improve our health, right? There's statistics that could support that. There's reasons why different populations have different diseases, and we look at that through research-based studies. What happens when you say, well, I don't trust the research? You start to lean on individualized or anecdotal evidence that is very, very biased, because if you're just leaning on one person's story, they only have one perspective. And so a wise leader is going to look at the perspectives of the masses and try to understand what is going to help move the masses forward. Even though each individual person matters, as a collective group, what can we do that? And we have a scientific way to do that. It's called the scientific method. So you don't have to believe in science. It's a way to collect data in a very formal, unbiased way. And that's what's happening at large scales in our United States. Our government, there's an arm of government called the NIH under the HHS that has been doing that for the last 70 years. And so when you start to question that, then other things start to become into question, is how is public health policy going to be informed? And it's not wise if it's based upon anecdotal opinion, because you don't have a biased perspective of what's going on. Now, if you want to create a new perspective, then you can do the new research studies, but it's going to take a long time. The Nurses Health Study, the Adventist Health Study, these studies that have thousands of people takes time, and it takes standardized measurements and way of looking at data. And that's not science. That's methodical, kind, wise ways of working with masses of people. Changing policy based upon an individual or a few individuals' opinion is dangerous. And that's not a political statement. That is from years and years of looking at leaders and how successful movements are made and how policies are driven in a very sound, wise way. Otherwise, you get things that are not good for all of us. Hope this helps. And from a nutrition point of view, every single person is different. I've been a dietitian for more than 2 decades, and there are definitely theories and things that you can apply. But then when you actually sit in front of somebody and you're looking at their individual food story, not one person is the same. And that takes a very artistic way of working with people. But again, that's different than trying to do a policy for millions. There are 2 different schools of thought, and they require 2 different conversations, trained scientists, people with a lot of experience in the field that can be wise and patient and kind. Hope that helps. Okay.